Good afternoon, everybody. Welcome to our COVID-19 update for Eau Claire. We're happy that you joined us again to get up-to-date information on what's happening in our community related to COVID-19, the data, and the response. So thank you for that. I ran up here because the paper was out when I was trying to print my notes, so sorry that I am gasping for air. It's not a good sign of your health department director's health status. So first of all, happy Nurses Day. We have an amazing team of nurses here at the health department, and kudos to them for the important work that they do every day. Certainly during COVID-19, it is critically important that we have that team in place, but we also have amazing nurses across the Chippewa Valley, and I don't know if everybody realizes how lucky we are to have a community that has a strong nursing presence. Not only the nurses that work here in all of our healthcare systems and in public health and all the community settings, but also really strong educational systems for nursing, both UW-Eau Claire and CVTC being based in here in Eau Claire with strong nursing programs. So kudos to all of them, and happy Nurses Day. Again, thanks for joining us today for the update. Some basic information I'll share with you first, and some updates that have happened around the state, and then certainly will be available for questions as well. In Wisconsin, we now have 87,826 negative test results available for COVID-19, 8,901 positive cases of COVID-19 from testing, an increase of 345 positives, 1,694 hospitalizations, and 362 deaths, an increase of 9. Our hospitalizations for COVID-19 are about 19% of those that have been tested as positive. The state continues strong work on building the contact tracing pool of people, the important piece, one of the legs of the stool that we need in order to have a strong response. They already have a team trained, and they are moving forward with utilizing those contact tracers in those outbreak situations across the state. In Eau Claire, we have not yet used that state resource, but certainly if we had a large outbreak, that is available to us as well. The state is also working on the testing side of things. One of the things that they are doing is making sure that a supply chain is available as much as possible for those that are doing testing. They are working on the National Guard site testing happening across the state, both outbreaks and for community testing like is happening in the Chippewa Valley this weekend. And they're focusing newly on long-term care testing in a more intense way. And we hope to hear more about that soon for our Chippewa Valley partners. In Eau Claire, we now have 47 confirmed cases of COVID-19 by testing, an increase of 3 since yesterday. Our testing numbers are 2,461 individuals tested for COVID-19. 2,334 of those are negative. The remaining are pending. We have 26 individuals that have completed their isolation period and are considered no longer infectious. So of the 47, 26 have completed that. Again, our age ranges from very young teenagers to people over 60. Some basic data for you from at both the state and local level, just to share some highlights. The state testing capacity is now reported at close to 15,000 tests, and we are testing really about 11,000 more than what has been previously done. So since Monday, you're seeing those testing numbers increase at a state level, and that's a good thing. We want more people tested. Locally as well, we're seeing testing numbers increase. Our 7-day average in Eau Claire County has increased from 38 a week ago to now 68 in this past week. So about 68 people a day on average are getting tested now. We likely will see a big jump in that with our community testing that will be happening in the next couple of days. So a large increase locally, that's something that we are particularly focusing on, and an increase across the state in their 7-day average, about a 25% increase in the 7-day average for testing numbers being done at the state level. So positive things happening there. The positivity rate is also something that we're carefully watching. So that's the percent of positives of the total tests that have been done. That has also risen locally, flattening a little bit now since Monday, but definitely we saw a considerable increase. We talked about that at our last press briefing. The Wisconsin positivity rate has stayed fairly flat, right around 10. Our positivity rate in April was 1.1% of the tests being run were found to be positive. In May, just the last week of May, we're at 5.59%, so almost 6% of our tests that are being run in Eau Claire are now positive. So that's one of those measures that we don't want going up, and it is right now, but certainly is something that we are tracking to see what happens with that. Since April in Wisconsin, the average number of deaths has been about 10 deaths per day, and new hospitalizations has been fairly average as well, but the decrease in our hospitalization percent is notable. So you may remember that when we first started talking, hospitalizations in Wisconsin were about a quarter of the positive cases were ever hospitalized, and now we're below 20% of those that are positives have been hospitalized. Those are all part of the criteria that we are looking at long term to see where this disease is going. Many of the data points that we are tracking are ones that are on the state website as well. We are working on a local dashboard and hope to have that more fully populated as time goes on. We know that data is important to many people. They're watching the data and watching what's happening locally, so we are working to make that readily available. As everybody knows, we are having a community testing site happening this weekend with National Guard personnel coming to help support that. So a reminder about that: on Sunday and Monday in Eau Claire at the Prevea site on Claremont Avenue, we will be having testing available for those 2 days broadly for anybody that's symptomatic. We are encouraging you to make sure that message is known very widely in our community. Anybody that's a Wisconsin resident can be tested at this site, and we are making sure that that information gets out, that it doesn't have to be just an Eau Claire County resident. It is a site that is free. Testing is free. You do not need a physician order or a physician signing a piece of paper for you. That will be taken care of at the site. People will be screened, but anybody that has even mild symptoms is being encouraged to come and be tested. The testing site dates are, again, Sunday, May 10th and Monday, May 11th. On Sunday, the hours are 8 to 5, and on Monday, 11 to 7 p.m. We're trying to have hours available for people that may not be able to come during those daytime or weekend hours. The push to get people with symptoms tested is an important one statewide. This is one of the efforts that we are doing to make sure that people are tested that are symptomatic. We know previously we were encouraging people with mild symptoms to just stay home and wait till they improved. That has changed now that we have better testing capacity available. We didn't have that even a couple of weeks ago. So while the message was strong a few weeks ago to stay home and not get tested because we didn't have enough test supplies, we now do want people with mild symptoms to be tested. The reason for this is that the quicker we know that someone is positive and the more we keep their circle very small and the people that have come in contact with them very small and keep them home, the less likely we'll have broad spread of disease in the community. Someone with even mild symptoms can give the disease to others if they don't know they have it. So we're strongly encouraging people to show up. If you're not able to make one of those 2 testing site dates, the community testing site dates, we continue to encourage people to talk to their provider and get tested. So even if you can't make those 2 dates, please make sure if you have symptoms that you call your provider and get tested. If you don't have a provider, the testing sites that are existing in Eau Claire County are ones that take people that don't necessarily have an attachment to a provider. And if you have challenges with that, please call our COVID hotline. That call center number is 715-831-7425. Information is available on our website about these community testing dates on Sunday and Monday if you need more information or need specific directions to get there. The website again is coronavirus.ecehealthdepartment.org. You can also get to our website by just going into COVID-19eauclaire.org. So we have a new way to quickly get there that's easy to remember, but it's just COVID-19eauclaire.org. Gets you to that same basic website that we have with all of our information. So again, with that testing, we will have more information about the disease spread in our community, and that will be an important snapshot in time. We want continued testing to happen, and we encourage people to continue to use physical distancing as their best way to stop the spread of disease. The Chippewa Valley Economic Recovery Task Force continues its work that is very closely connected to Incident Command, or our efforts that we report to you about the disease and about response to the disease. We are working in partnership with that group to make sure that they have good information, best practices to open businesses as we are able to do that. The Economic Task Force does have their information in our website as well, so finding out more about the Chippewa Valley Economic Recovery Task Force can be found at the same website that I just mentioned. Today there was an overview for a broad group at a town hall meeting for the Chamber, where both myself and the co-chairs of that group presented, and lots of energy and lots of interest in how we move forward successfully in the Chippewa Valley. I'm pleased to see the interest in making this all work successfully. Some very quick additional updates. Yesterday, the Supreme Court of Wisconsin heard oral arguments related to the case that the legislature brought forward regarding the order. We have not yet heard a communication about a ruling for the Supreme Court, but certainly as soon as we hear something and we know the implications for our community, we will be sharing that. We also have talked regularly about the Badger bounce back metrics, the numbers that are being utilized to look at reopening and to track the disease progression in our state. Recently, the state added, yesterday or the day before, added additional metrics for hospitals, and those metrics help us understand the capacity of hospitals to deal with a potential surge in COVID-19 patients. So those measurements are available on their website, and they will be starting to track that as well. We are watching those numbers because that is an early indication to all of us, both our ability to manage disease, which will come, and what disease looks like currently will help all of us understand better how to be responding in local communities. So critical numbers for all of us in Eau Claire as well. A reminder to everybody that we all are in a situation where none of us are immune to this disease. We are asking people to continue to have common sense approaches to preventing getting ill themselves. Make sure you're keeping physical distance. Make sure you're washing your hands regularly, not touching your face, and making sure you're practicing really good health habits, both for your mental health and for your physical health. It's not easy. We know it's different than what we would like to be, but we are in a place where the spread of disease is concerning, and doing those things to keep ourselves healthy and those we love healthy is important. We hope that people continue to make those healthy choices as we move forward. Again, our website, covid19eauclair.org. The call center number, if you have questions after looking at that site, is 715-831-7425. And we will continue with our regular media schedule Monday, Wednesday, and Friday, and certainly am available now to answer questions. Yes?
Republican state legislators put out a news release this afternoon saying that they're having a news conference 10 tomorrow at Lupe's calling for a regional reopening. Just wondering if you have any reaction to that.
I'm assuming this is a local legislator? Yeah?
It's legislators, the Republican area legislators. Yeah.
Okay. So the question is related to Republican area legislators doing a press briefing tomorrow about potential of regional reopening. There is a lot of conversation about regional reopening happening across the state. We certainly have seen that from the Wisconsin Manufacturers and Commerce Group, from many members of the state legislature. We are in a statewide order right now. The importance of a statewide order is that we are tracking not only what the disease looks like at a state level, critically important because we know this is a disease that isn't for just a specific region. Even if we have lower case numbers here than other parts of the state, we have the same risk of getting disease here. So the minute we open up and the minute we start testing more, we will see more cases. It's also important from a public health standpoint to really think about the focus point not being about opening on a certain date or opening a certain region, but really opening based on risk. So that is something that we very much are talking about, that in ways that we can avoid risk, where places that we can assure physical distance, where we can assure that people are monitoring sick employees and making sure that sick employees stay home. All of those basic strategies can be in place. We certainly should be considering reopening across the state. And that is an important conversation that's happening in all sectors. And I believe that as we walk forward between now and phase 1 of the Badger Bounce Back Plan, that we will have strategic reopening happening based on risk. My encouragement is to consider risk first and not region and the data from a region first. Data from a region can be very, very deceptive because of the testing, because of the lack of spread. The minute we open a region with the travel that we will have problems. So really approaching this in a way that is based on risk makes the most public health sense. Yes?
With the increased number of testing, are the labs able to, keep up? Are people still around the same wait time and getting results back? Is there any type of backlog coming with it?
Yeah, so commenting on testing and whether or not we're seeing any, with increased tests being conducted, whether we're seeing any challenge with getting results back. We have not seen in the Eau Claire area any challenges with getting results. Typically, we get a result 24 to 48 hours after the test is conducted. We are getting quick responses. We do have some capacity in Eau Claire for even more rapid response, but there's a small number of tests available for that kind of purpose. But we are seeing really quick results back for all the testing that we're having happen in this area. Initially, test results were taking longer. Some of the labs were still setting up their systems, setting up their supply chain and how things worked, and they had to work through some bugs, at least in the first couple of weeks, but more recently we are not seeing that. Yes?
Lisa, how do you feel in terms of contact tracing capacity? I know you have spoken in the past about building up for that, how important that's going to be going forward, especially once we all do start reopening and getting together again. It's kind of a broad question, but can you just talk a little bit about what that looks like right now?
Sure.
Where it's at in terms of readiness?
Yeah, so the question is really about how ready are we for contact tracing and the potential that we'll have to do a lot more contact tracing with the increase in the number of cases. I would add also that we will have more contact tracing to do the more we are out in the community. So we've talked about this before, but right now with our circles very small, we have a smaller number of potential contacts to work with for any one individual case, but the more all of us are out in the community, the likelihood that we have a higher number of contacts to work with is going to be there. It's one of the things that we're looking at over time. In Wisconsin, we are working very hard to partner with the state right now to make sure that we are working in tandem to come up with a plan for contact tracing. Most contact tracing for any other disease happens at a local health department level, whether it's gonorrhea or any other disease. We do a lot of contact tracing already to make sure that people that have been potentially exposed understand their exposure risk and do something about it. For this disease, because it is new and we don't necessarily have the existing capacity to deal with this number of positive cases in a short amount of time, we are having to build contact tracing capacity. How we're approaching it locally is that we've started with an internal team of people that we have trained that don't typically do this work, but that are willing and able to learn it and work with our nurses primarily to partner to get the contact tracing investigations to happen. So there's a core communicable disease expert that is assigned to the case themselves, and then there may be contact tracers that don't necessarily have the depth of experience but have been well trained to do those contact investigations. That capacity we've already started. We've trained a number of people locally, internally to do that work. We trained a whole new pool of people on Monday to additionally add to that team as we are starting to ratchet up in our cases, going from 20 cases a few weeks ago to 40, over close to 50 cases today. We've definitely needed that. We know that the number will increase and we likely need more. So we are working on a plan to sort through who are the logical volunteers and resources in our community to train for the next wave as our numbers increase. We expect them to increase, and to do that work. And we're partnering with the state right now to see how they will be deploying their promised 1,000 contact tracers. Some of those people will remain centrally located for outbreaks. We would utilize them if we had a very large outbreak in a situation. Some of those we're encouraging the state to potentially have as regional assets, people that know our area and our community a bit better and can be a better resource more locally. Contact tracing work is not easy. I think there is maybe a misperception about that for most people, it's a complicated thing to actually interview them well, get them to understand the seriousness of this disease and why they have to stay home for 14 days. That's not an easy ask for anybody to understand what the limitations are and why it's so critical that they follow the requirement to stay home for that amount of time. It takes a really good communicator to do that well. Often, we also have to have someone that really understands local resources. So if it's somebody that has barriers related to getting food, having housing, having social and emotional support, that needs to be someone that understands that and doesn't just tell them, stay home for 14 days and then hangs the phone up. So it's a critical job. We all need to count on that being done well. The contact tracing work, if it's not done well, we will have spread of disease in our community. So we need to assure as the health department that that happens and that we have well-trained people. So we're stepping through that, and we know we have, fortunately, many people that are willing to help support that work, and we are working through training them right now.
Is there any kind of a timeline when you think you need to be sort of up and running, if that makes sense?
Sure. So the timeline for being up and running is the question. We are up and running now with our large increase, the doubling of our cases in the last couple of weeks. So we have a number of new people already working. Those people are training the next tier of people. And so in the next week or so, we will have a fairly robust group of people. Some of the national estimates say about 35 contact tracers per 100,000 population is a guess. So we have that as a general target that we are working on locally with our population being about 100,000 people. But everybody needs to understand that that's a moving target. That is our first guess nationally at about what we should have. There are different numbers out in the national literature about that, but we are using that one as a general target. And we are working toward that number. Yeah.
I had a question about the testing increase locally. You said an average of 38 tests daily to 60. I'm wondering what the reason is for that locally. Is that just higher testing capacity? Is that working through agents that are going to keep on tests?
Yeah, so the question is related to the increased testing numbers that we're seeing happening locally in our area. So we know that that's happening for a variety of reasons. There isn't probably one singular reason that that's happening. Some of the reasons include the fact that we have more places actually able to do tests. We have increased capacity of labs across our system, so all of our healthcare partners are regularly working with us and increasing their ability to do tests. Oakleaf Clinics, as an example, is bringing on testing capacity within their system soon, if it's not already happened. So each of those testing sites is having more ability to do that broad-based, symptom-based testing, where even 2 or 3 weeks ago they didn't have that. Some of the systems have gotten new supplies as well, so that's a piece of it, that places that didn't have enough supply before now are able to access some of that. We also know that increased testing is also happening because some of the hospitals are starting to reopen some of their surgical capacity and are doing more surgeries, and in those cases they are testing everybody that comes in, symptomatic or not, prior to surgery. So there's a whole variety of reasons people are being tested. In the last couple of weeks, it's really been only those few weeks where we've opened up testing more broadly to mildly symptomatic individuals. So the community is starting to understand that if they have those mild symptoms, they can come in for a test now. So that demand is also there. That whole constellation of reasons is, I'm sure, contributing. And we're hoping that we continue to get the message out that while a month ago we were saying, don't get a test if you only have mild symptoms, we are now saying we have enough capacity, please come in and get a test if you are mildly symptomatic. All of us are redoing that message and paying attention to that, hopefully. Yes?
What would you like to see that number at? And maybe that's a moving target, but it's good. It went from 38 to 68 average.
Mm-hmm.
Should it be 100, would you like? Is there a ballpark given the number of cases you're seeing now?
Yeah, it's a good question. So the question is, what's our target for the percent of population tested? That metric, that number, is actually being worked on right now, and I hope to be able to share that because I think we all want to understand what the goal is. So I'm working with a partner right now to research through what should be a good goal. The state certainly does have a goal. We would like to also have a local goal so we can start measuring how are we doing compared to what we should be doing. As the state looks at testing, this Chippewa Valley area is not considered a place where they're highly concerned about the number of tests being done per population. In comparison to the rest of the state, we actually look pretty good. My concern is that we really want to compare ourselves to what we should be at, not compare ourselves to places where there's no testing happening. So we're working on that. Yeah.
You keep a pretty even keel, whether it's 3 cases in 3 weeks like we recently had or 9 new cases on Monday. And just keeping my ear to the ground, listening out there, it seems like some of the buzz in the last few days has been people are like, wow, it's getting really bad. So what would you say to people as they do see these numbers, especially after a low period for quite a while there? How would you encourage them to view it?
Yeah, the question is how should we be viewing the fact that we've been seeing increased cases happening in the last week, which is different than the couple weeks prior where we had a number of days in a row where there were no increased cases. Really, the bottom line is that we assume that we will get cases in Eau Claire County. It's not a surprise that we have increased numbers. We are having increased testing, so we are finding some of those cases where we may not have been seeing them previously. We also have people that are working in essential businesses that are out in the community, and disease spread is happening. This is a disease that is very contagious. When people are in close physical contact, they are likely to be in those exposure situations, in a situation where they may get disease. So an increased disease number is concerning. I think our concern primarily with COVID-19 is that we don't want to have a huge surge. And that is the reason that physical distance and those common sense measures to make sure that we have minimal spread of disease is really our goal. It's a strange public health position to be in where we're not talking about preventing COVID-19. We're not going to be able to do that in this situation. It's really about minimizing the negative outcomes of having lots of people sick and lots of people dying at the same time. Yes?
We received information suggesting that an Eau Claire motel has 6 identified cases of COVID-19. Can you confirm or deny that?
So the question is related to, does a motel in Eau Claire have COVID positive cases? I'm not able to comment on that specifically. We are working with all of our COVID positive cases across, the more than 40 people that are have been COVID positive. All of those have very careful investigation, and for those people that need housing, they are certainly being supported with housing in our community, and we are working very carefully to make sure that they are staying safe and healthy. And everybody in Eau Claire know that isolating those people that are positive is an important part of the work we do. Yes.
I've seen a couple of different articles in the last couple of days about masks, and some are making some suggestions that maybe it has some negative reactions for you as a mask wearer in terms of breathing in your carbon monoxide. Anyhow, do you have any comments on the mask wearing and any potential implications it has for you as the mask wearer?
So the question is related to wearing masks and any comments about use of masks and any potential negatives in using a mask. The CDC recommends, as does the state, that in order to prevent disease transmission as much as possible, that wearing a cloth face covering in situations where you know that you may be coming in close contact with another individual is one of the methods to help prevent disease transmission. It is, again, in a very crude way, catching your spit as it's coming out of your mouth and nose and stopping it with that face covering. So it is important that people consider wearing a cloth face covering when they're out in public, and something that we are encouraging happens. We are also supporting those businesses that say that they are asking people to wear a cloth face covering when they come into their business, and that is an important strategy to help prevent disease. 2 masks in a situation where 2 people are in close contact is the best prevention. So my wearing a mask helps keep my COVID-19 inside of me if I have disease. The person I'm interacting with in a close way, if they have a mask, they are also preventing, and that decreases the possibility of spread. So that is the recommended course. There are some people that do have difficulties with wearing a mask and should really evaluate that with their primary care provider. If they have one, they certainly can call the COVID-19 call center as well. Masks are not recommended for people under the age of 2. So young children, we do not recommend masks being utilized in that situation. And if they have a condition that makes breathing difficult. So people with COPD, people with significant breathing issues, masks may be problematic for those individuals, and certainly talking with your healthcare provider about that is important. The average person should not have large challenges with wearing a mask. It might be uncomfortable. It may not be the fashion choice that you want, but it is certainly something in the current situation to strongly consider. Those cloth face coverings can be really important way to stop transmission of disease. Physical distance is still the first. We want people to have that as their primary way to stop transmission, but in certain circumstances that may be challenged, and having a cloth face covering will be helpful.
Did you watch the State Supreme Court hearing yesterday, either live or recorded? And if so, do you have any comments on it?
So am I aware of the State Supreme Court hearing, and do I have any comments on the content of it? I was not able, because of all the work that we are doing, to really watch it. I saw small snippets as they were on in one of the rooms that I was in, but I did not watch directly. We had people monitoring it, and we do have summary statements on the State Supreme Court conversation, and certainly are monitoring not only the types of questions that were asked and the responses given, but also thinking through what the next steps might be. There are lots of questions about that, and I think our job right now is to pay attention to how are we responding to the disease right now, and how are we preparing, no matter what the outcome is, for disease progression in this community. That's our responsibility, and that's what we're paying attention to right now. So thank you, everyone, again for being with us today. We will be back on Friday. I'm certain we'll talk again about our community testing site that will happen on Sunday and Monday, and bring you any additional updates at that point in time. We encourage people to call the call center number 715-831-7425 and go to our website, covid19eauclair.org. Thank you for what everybody's doing to keep themselves safe and keep their community safe by keeping physical distance and doing those common sense things to not spread this disease. Thanks.